What is a widened mortise? What does that mean? So if you're working in the ER or you're in your office or you're working in an urgent care center and a patient presents with what you think is an ankle sprain, you should probably get x-rays, and then you need to evaluate the x-rays specifically to see, number one, if there's a fracture or a broken bone, or if there's a syndesmotic injury. Because a syndesmotic injury is something that we treat with a specialized casting technique, or a lot of times we end up taking them to surgery. If a syndesmotic injury is missed, that can cause the patient to have early onset of arthritis. So you don't want to miss a syndesmotic injury. So I'm going to show you some x-rays. This is the x-ray of an ankle. This is the fibula bone right here. This is the tibia or your shin bone. It's the lower part of your tibia. This is known as the medial malleolus. This area here constitutes the ankle joint. And you can see how this distance, the dark area, is about the same as this distance here, is about the same as this distance here. It looks like it's about 2 to 3 millimeters around. This is a normal ankle without a syndesmotic injury. Now move over to this x-ray, and this is an x-ray with a syndesmotic injury. Can you see where the problem is? It's right here. See how wide this area is between the medial malleolus and the talus versus the area between the fibula and the talus and the distal tibia and the talus. So this area is much widened. That is a syndesmotic injury. You have to be concerned about a syndesmotic injury because if that occurs, it can cause abnormal forces on your talus, which is part of your ankle bone, which then can result in early arthritis or an unstable ankle, which is really not doing any service to your patient. So what we typically do with a syndesmotic injury, and from an orthopedic perspective, is we need to reduce it or get rid of it. So typically with a syndesmotic injury, this ligament called your interosseous ligament, which you cannot see, is torn, or this deltoid ligament is torn. So this patient has what's called a tightrope, which is where we drill a hole through this bone, and you can kind of see the remnant of the drill tunnel. And we have a device here and a device here that we tighten, which pulls these two bones together, reducing that syndesmotic injury. Another way to fix it is with 2 screws or 1 screw, depending on the surgeon. And these screws are placed to pull the fibula bone into the tibia, which then again reduces that syndesmotic injury. So if you're moonlighting or you're in your office and you get x-rays of an ankle, make sure on the mortise view of the ankle that you look at this is called a mortise view. It's an ankle x-ray taken with the foot with about 15 degrees of internal rotation. So pretty much anytime you get an ankle series, if you ask for ankle series, you're going to get an AP, a lateral, and a mortise view. And the mortise view is where you need to look for the syndesmotic injury. So this is a mortise view. This is a normal syndesmosis. This is another mortise view, and this is wide and very abnormal.